than it should be. And they have extra things added which cats with kidney disease are vulnerable to losing in their urine, such as B vitamins and potassium. So lots of modifications, and overwhelmingly the best outcome if your cat can be persuaded to eat a renal prescription diet. However, many of you may well have experienced problems with encouraging your cat to eat anything, let alone a renal diet. And this certainly is a problem that we face in our cats with kidney disease. So how do we encourage appetite and transition onto our renal diet? Well, firstly, I think it's very helpful to identify as many as possible complications that may be present in your cat, which could be affecting appetite. So, for example, if blood potassium levels are low, our cats will tend to not want to eat, and we can easily correct that by treating them with potassium. So address all those complications where at all possible. General nursing tactics like gently warming the food, hand feeding, stroking your cat, having it sitting on your lap, all these sorts of things definitely can help. So ask your nurse for tips on nursing techniques to encourage appetite. Also remember that it's always better for your cat to eat something than nothing. So if your cat's not interested in a renal diet, offer something else. Food is always much more important than the specific type of food. And bear in mind that whilst the aim is to get your cat to be eating a renal prescription diet 100% where at all possible, really that's something that may take you weeks or months to achieve. It's certainly not unusual with my patients for this to take 6 months to encourage a cat to fully accept a renal diet. And lastly, there are appetite stimulants that can be used to encourage appetite as well. So that's also something else to potentially ask your vet about. It's also common for cats with kidney problems to suffer from dehydration, and that's very damaging to them, both in how they feel on that particular day, but also how their kidneys function as well. So every effort possible should be paid towards encouraging fluid intake, making sure that your cat always has ready access to water sources, and perhaps encouraging the cat to drink by adding some liquidized prawn juice to your water bowl to make it a little bit tastier, for example. In some cats that have particular problems with thirst, it can be helpful to actually give them fluids under the skin. This is called giving subcutaneous fluids, and the picture of the black cat shown here having this therapy. And this is something that you can do with your cat at home if it needs it, and your veterinary clinic should be able to train you in doing that. We also, on our website, the Cat Professional website, have a free download section which has got a lot of useful resources on it, including handouts on how to give subcutaneous fluids, and also a PowerPoint presentation on how to encourage your cat to drink more. Blood salt levels is the next area to mention, and problems with phosphate and potassium are most common. So with phosphate, it's actually an increase in blood phosphate levels that is the problem, hyperphosphatemia, whereas with potassium, it's actually a deficiency, hypokalemia, which interestingly is the opposite of what happens in people with kidney disease, where often they have problems with accumulation of potassium. But in cats, they tend to lose it. And both of these salt problems can cause major problems to the cat, put them off eating their food, and really dent their quality of life, as well as potentially the length of life as well. Phosphate control in particular appears to be associated with a much improved survival. So your cat will live longer, in other words, if you can manage blood phosphate levels appropriately. And there are lots of things that you can give, some pictures shown on here that help with both of these problems. High blood pressure definitely should be treated if it's diagnosed. The two drugs that we mainly use for this are amlodipine, which is actually a human drug shown in the top picture on the right hand side. The bottom picture shows one of the forms of benazepril. This is Forticor in this example, but there are other versions now available. Of the two, amlodipine tends to be much more potent in lowering blood pressure. So if you have a cat with high blood pressure, you're probably more likely to receive that treatment for your cat. And the cat on the left is having blood pressure measured. Benazepril Forticor is one of the brand names of benazepril, is a drug called an ACE inhibitor, angiotensin converting enzyme inhibitor. And these drugs have also been licensed for treatment of kidney disease in cats. And the background to this was that actually they are used extensively in human medicine, people with kidney disease, where treatment with an ACE inhibitor has been shown to prolong survival. And the two main ways that these drugs work is by reducing protein loss into the urine and also reducing blood pressure in the normal circulation, but also blood pressure within the kidneys. And they do have beneficial effects in cats with kidney disease, but they are especially indicated for those cats that have high blood pressure or are losing large amounts of protein in their urine. So again, your vet may recommend this treatment for your cat depending on their situation. And clinical studies have shown that cats treated with these ACE inhibitors also had improvement in their quality of life when monitored by their owners. And as you can see at the bottom of the slide, a separate study actually showed that they did appear to have some appetite stimulating effects of their own, which is potentially very helpful in a cat with kidney problems. Beyond these treatments that I've mentioned, there are other things that certainly may well be needed. So, for example, a cat on the left-hand side down here is suffering from cystitis, a urinary tract infection, and treatment with antibiotics certainly indicated for that. Catalax is a good treatment if your cat gets a bit constipated, and that's something else that cats with kidney problems are vulnerable to developing because particularly if they get dehydrated. Anemia, also I mentioned, this is the membranes lining the cat's eyelid, which you can see are also very white, and so treatment with things like iron and also a hormone, erythropoietin, can be helpful to these cats as well. So there are a number of things that that we haven't mentioned which your vet may recommend to you. Checkups are really vital in these sort of patients to monitor progress, because it's very difficult as well to assess changes in body weight, for example, with your cat at home, but also to get the support that you need from the rest of your team as well. So, for example, if your cat is not accepting a renal diet, your vet and vet nurse should have lots of tips for you, perhaps different brands of diet to try as well that can help support you through this and also help to detect any other changes in your cat that may indicate complications that could be treated. The prognosis often is excellent. There are so many more options now, so much better treatments. So don't be dismayed if your cat has recently been diagnosed with this problem, because in many cases it is possible to manage the cat for years whilst maintaining a good quality of life. Additional support that you might find helpful, firstly from my own website, catprofessional.com. Also, we have at the moment a survey which we're doing, which is for owners of cats with kidney disease, and we're asking about your experiences of kidney disease and your understanding of some of the treatments. And if you're interested in participating, which obviously we would be very grateful for, then as a thank you for your hard work, you also will be able to get a free electronic copy of my latest book on kidney disease, the picture of the book cover shown on the right hand side of this slide. The book is available obviously to purchase separately, so you don't have to do the survey, and indeed you can buy it in a print form for $9.99 if you'd rather have a printed version of the book. The Feline Advisory Bureau also has an excellent website, so if you haven't already discovered that, please have a look at that. And also on the Cat Professional website, we have a links page which has some useful links for other kidney websites as well, including the Iris one I've mentioned. Your vet practice also may be able to provide you with additional support in the form of other literature, for example, from the manufacturers of some of the diets and the drugs that I've mentioned, that hopefully will be able to speak in a language that you can understand and explain a bit more about the complexity of the disease. Key points really for kidney disease in cats are it is complicated. Kidneys are doing an awful lot of different things, so it's not an easy condition to manage. of all of the treatments, dietary treatment is the single most helpful treatment, the most proven one. So any effort that you can make to transition your cat onto a renal diet will definitely have a positive impact on their well-being, and the length of time that you have with them as well. There are also obviously a lot of other treatments that may be indicated in individual cats, and the best approach really is to have a thorough assessment and individualize the treatment plan to that particular cat so that you can do the very best for them. But as I've already emphasized, many cats with this condition do live for several years with an excellent quality of life, in spite of this diagnosis, and many owners are absolutely brilliant at managing their cats as well. So I hope that I've been able to pass on some useful information, and maybe trigger some discussion between yourselves and your vets. And also I hope very much that you will take the time at some point to visit our website and have a look at the free download section in particular. We've also got some little videos as well that you might be interested in. Thank you very much.
Thank you, Sarah. That was very, very good. Enjoyed that.